Hello, hello. This is Dr. Alan Mandell, and today I need to share something with you that most doctors never talk about. If you are over the age of 60 and you have been told that squats are the best exercise for your legs, I want you to stop and listen very carefully to what I am about to say. Because squats, the exercise that fitness experts have praised for decades, may actually be one of the worst things you can do for your knees, your hips, and your balance once you reach your 60s, 70s, and beyond. Now, I know that might sound surprising, but here is what the research tells us. As we age, the cartilage in our knees gradually wears thin. The joints in our hips begin to lose their cushioning. Our sense of balance, controlled by something called our proprioceptive system, becomes less reliable. And when you combine all of those changes and then ask an older adult to perform a deep squat under load or even body weight, you are asking for trouble. Falls, knee pain, hip strain, torn cartilage. These are the outcomes I see in my clinic when older patients push through squats that their bodies are simply not designed to handle anymore. But here is the great news, and this is why I am so excited to share this video with you today. You do not need squats to build powerful, functional leg strength. Not at 60, not at 70, not at 80, not even at 90. In the next few minutes, I am going to walk you through 5 specific chair-based exercises that are used in top hospital rehabilitation programs across the country. These movements target the exact same muscle groups as squats: your quadriceps, your hamstrings, your glutes, your calves. But they do it in a way that eliminates joint compression, eliminates fall risk, and is completely safe for knees and hips that have seen a few decades of life. By the end of this video, you will have a complete, doctor-approved leg training routine you can do from any sturdy chair in your home, starting today. So if you are ready to walk stronger, stand taller, and move with confidence again, stay with me. This one is going to change everything. Before we get into the exercises, I want to spend just a couple of minutes explaining why squats become problematic as we age. I think when you understand the science behind this, it will make total sense, and you will feel completely confident choosing the smarter path forward. When you perform a traditional squat, your knee joint is forced to bear an enormous amount of compressive force. Studies from Johns Hopkins University have documented that during a bodyweight squat, the pressure on the knee joint can reach 7 to 8 times your body weight. For a 150-pound person, that is over 1,000 pounds of force being driven directly through the knee cartilage, the meniscus, and the surrounding ligaments. When you are 30 years old and your cartilage is thick and resilient, that is manageable. But after 60, research published in the journal Arthritis and Rheumatology confirms that by age 65, more than half of adults have measurable cartilage degradation in at least one knee. Many don't even know it yet because the pain hasn't started. So squatting on already compromised cartilage is like driving a car with bald tires on wet pavement. You might make it through, but you are wearing the tires down faster with every mile. There is also the matter of balance. After 60, our vestibular system, the balance center in our inner ear, begins to decline. Our reaction times slow. And research from the National Institutes of Health shows that falls are the leading cause of injury-related death in adults over 65. Squats, especially without a spotter or support, place older adults in a vulnerable position where a moment of dizziness or a slip can lead to a devastating fall. So what is the solution? chair-based resistance training. And here is the beautiful thing. When you train from a seated position, you remove the compressive forces from the knee joint while still placing the muscle under productive tension. You eliminate fall risk while still achieving meaningful resistance. You work the same neural pathways, the same muscle fibers, the same movement patterns, just without the danger. Research published in the Journal of Aging and Physical Activity has shown that chair-based exercise programs produce comparable strength gains to standing exercise programs in adults over 65. In some studies, particularly for those with knee osteoarthritis, the seated group actually outperformed the standing group. That is not a compromise. That is a smarter strategy. So let us get into the 5 exercises. I want you to have a sturdy, armless chair ready, one that does not have wheels. Sit tall, feet flat on the floor, and let's get started. Our first exercise is called the seated leg press against wall. And if I had to pick just one exercise for leg strength in older adults, this might be it. Here's how you do it. Sit in your chair and move it until you are about 2 feet away from a solid wall. Sit up straight, core gently engaged, and extend both legs out so that the soles of your feet are flat against the wall. From this position, you are going to push into the wall, as if you are trying to push it away from you, using the muscles of your thighs and your glutes. Hold that push for 10 seconds. Then relax for 5 seconds. That is 1 repetition. You are going to do 10 repetitions, rest 60 seconds, and repeat for 3 sets. Now let me explain what is happening in your body during this exercise. What you are performing is called an isometric contraction. Your muscles are producing maximum force, but your joints are not moving. There is 0 compression on the knee cartilage, 0 shear force on the hip, but your quadriceps, your gluteus maximus, your hamstrings, they are working at full intensity. A landmark study from the Journal of Strength and Conditioning Research found that isometric leg training, performed consistently over 6 weeks, produced strength gains of 15 to 20% in older adults, comparable to dynamic squat training, but with a fraction of the injury risk. What I love about this exercise is that it also trains your brain. It reinforces the neural connection between your mind and your leg muscles, what scientists call neuromuscular activation. And that connection is critical for balance, for walking, and for getting up from a chair safely. Dr. Mandell's tip: as you push into the wall, think about squeezing a walnut between your buttocks at the same time. That extra glute activation will dramatically increase the effectiveness of every single rep. Exercise number 2 is the assisted sit to stand. And this one is special because it does not just build muscle, it trains the exact movement pattern your body needs most in daily life. Think about how many times a day you rise from a chair, from the kitchen table, from the couch, from the toilet, from the car seat. Every single time you do that, you are performing what physical therapists call a functional movement. And if that movement becomes difficult or painful, it affects your independence in a profound way. Here is how to perform the assisted sit to stand correctly and safely. Sit at the edge of your chair, not all the way back, but perched on the front third of the seat. Place your hands lightly on the armrests or on your thighs for assistance. Lean your chest slightly forward, what physical therapists call the nose over toes position. This shifts your center of gravity forward and makes rising much safer. Now, pressing through your heels and your hands for support, slowly rise to a standing position. Pause at the top for a full 2 seconds. Then, slowly, and I mean slowly, do not plop back down. Lower yourself back into the seated position, taking 3 to 4 seconds to descend. That controlled lowering is called an eccentric contraction, and it is one of the most powerful muscle-building signals in the human body. Do 10 repetitions. Rest 60 to 90 seconds. Complete 3 sets. As you get stronger over the next few weeks, you can progress by using your hands less and less, until eventually you are rising without arm assistance at all. Now, the science behind this exercise is remarkable. A study published in the Journal of the American Geriatric Society followed older adults who performed the sit-to-stand exercise just 10 times per day. After 12 weeks, they showed significant improvements in gait speed, functional independence, and, critically, a measurable reduction in fall incidence. The reason this exercise is so powerful is that it works the entire kinetic chain: your quadriceps, hamstrings, hip extensors, and even your core, all in one coordinated functional movement. Dr. Mandell's tip: do not rush the lowering phase. That slow descent, 3 to 4 seconds down, is where much of the strength-building magic actually happens. If you want faster results, slow down. Exercise number 3 might look simple, but do not let that fool you. The seated heel and toe raises target an area of the leg that most people completely overlook, and that neglect has real consequences for circulation, balance, and fall prevention. We are talking about the lower leg, specifically the calf muscles, called the gastrocnemius and the soleus, and the muscles along the front of the shin, called the tibialis anterior. Here is how to perform both movements. For the heel raise, sit up straight in your chair, feet flat on the floor. Keeping your heels on the ground, lift the fronts of both feet, your toes and the balls of your feet, as high off the ground as you can. Hold for 2 seconds at the top, then lower slowly. That is 1 repetition. For the toe raise, now the opposite. Keeping the balls and toes of your feet on the floor, lift both heels as high as you can. Hold for 2 seconds. Lower slowly. Alternate between heel raises and toe raises, 15 repetitions of each, for 3 sets total. Now, here is why this exercise matters far more than most people realize. Your calves are sometimes called the second heart. Every time your calf muscles contract, they squeeze the deep veins of the lower leg, pushing venous blood back up toward the heart against the force of gravity. This is called the venous muscle pump, and in older adults, a weak or sedentary calf muscle leads to blood pooling in the lower legs, increased risk of blood clots, swelling, varicose veins, and even deep vein thrombosis. Research published in the Journal of Vascular Surgery confirmed that regular calf muscle activation exercises significantly improve venous return velocity and reduce DVT risk in older sedentary adults. And the tibialis anterior, the muscle on the front of the shin, is directly responsible for lifting your foot when you walk. When this muscle is weak, your toes catch on the floor or the carpet as you take a step. That is called foot drop, and it is one of the most common causes of tripping and falling in people over 65. Strengthening this muscle may literally save you from a fall. Dr. Mandell's tip: do this exercise whenever you are sitting for long periods, watching television, at the dinner table, even in the car as a passenger. 5 minutes of alternating heel and toe raises keeps your circulation moving and your leg muscles engaged throughout the day. Exercise number 4 is the seated knee extension with hold, and this targets a very specific part of the quadriceps muscle that is absolutely critical for knee stability in older adults. The muscle I am talking about is called the vastus medialis oblique, or VMO for short. You can see it just above and slightly to the inside of your kneecap. It is that teardrop-shaped muscle that bulges when you fully straighten your knee. In older adults, this muscle is often the first to weaken, and when it does, the kneecap begins to track incorrectly, causing pain, grinding, and instability. Here is how to perform the exercise correctly. Sit up tall in your chair. Lift your right foot off the ground and slowly straighten your right leg until it is completely extended, fully locked out at the knee. As you reach full extension, you will feel that little teardrop muscle kick in. That is your VMO firing. Now, here is the key. Hold that fully extended position for a full 10 seconds. Breathe normally. Do not hold your breath. Keep the quadriceps tight. Then slowly lower the foot back to the floor over 3 to 4 seconds. Do 10 repetitions on the right leg, then switch to the left. Complete 3 sets per leg. When you are ready to progress, and I want you to progress, you can add a light ankle weight, starting with just 1 pound and gradually increasing over weeks. You can also place a small rolled towel under the back of the knee for a slight elevation, which increases the range of activation of the VMO. The science behind this is very well established. Research from the American Journal of Physical Medicine and Rehabilitation found that terminal knee extension exercises, meaning exercises that focus on that last few degrees of knee straightening, produce superior VMO activation compared to full-range squat movements. This makes seated knee extensions with hold an elite tool for knee rehabilitation and prevention. And here is what I tell every patient I see. A strong VMO is a stable knee. A stable knee is a knee that lasts for decades without pain. This exercise is your insurance policy. Dr. Mandell's tip: try to feel the VMO. Put your fingertips on the inside of your thigh, just above the kneecap as you straighten. Feel that muscle tighten? That is strength being built in real time. That awareness deepens the neuromuscular connection and makes every rep more productive. Exercise number 5 is the seated hip abduction. And of all 5 exercises, this one may have the single greatest impact on your ability to walk safely and avoid falls. Here is why. The muscle we are targeting, the gluteus medius, is located on the outer hip, and its job is lateral stability. Every single time you take a step, your gluteus medius fires on the standing leg to keep your pelvis level and prevent you from tipping sideways. When this muscle is weak, and in older adults it is almost always weak, the pelvis drops to the opposite side with each step. You may have seen this in yourself or a loved one, that slight swaying or lurching gait. That is a weak gluteus medius. Weak gluteus medius equals poor balance, altered gait mechanics, hip pain, and dramatically increased fall risk. Here is how to strengthen it from your chair. Sit up tall. Place a resistance band just above your knees, or if you are just starting out, use your hands pressing inward on the outside of your thighs for manual resistance. Now, keeping your feet flat on the floor, slowly push your knees apart, out to the sides, against the resistance of the band or your hands. Push as wide as you can. Hold that fully abducted position for 3 seconds. Then, slowly bring your knees back together, resisting on the way in as well. Do 12 to 15 repetitions. Rest 60 seconds. Complete 3 sets. The resistance on the way back in is important. Do not let your knees snap together. That controlled return movement, called adduction, simultaneously activates your inner thigh muscles, giving you a dual-purpose exercise in every single rep. Now let us talk about the research. A study published in the Journal of Orthopedic and Sports Physical Therapy found that hip abductor strengthening exercises reduced fall risk in older adults by 30 to 40%. That is not a small number. That is a dramatic, life-changing reduction, achieved with a simple seated exercise that can be done at home with a $10 resistance band. Dr. Mandell's tip: as you push your knees out, think about pressing your feet firmly into the floor at the same time. This co-activation of the glutes and the lower leg creates a whole chain stability response, and it more closely mimics what your body does when you are walking and balancing in real life. Now that you have learned all 5 exercises, I want to step back for a moment and talk about the bigger picture, because I think understanding the science will inspire you to stay consistent, and consistency is everything. Here is the reality of what happens to our muscles as we age. Starting at approximately age 30, the human body begins losing muscle mass at a rate of 3 to 5% per decade. This process is called sarcopenia, from the Greek words meaning poverty of flesh. And after age 60, that rate of loss accelerates significantly. Research from the National Institute on Aging has found that by age 70, the average person has lost up to 30% of the muscle mass they had at their peak. By age 80, some individuals have lost nearly half. The consequences of this are not just cosmetic. Muscle is metabolically active tissue. It regulates your blood sugar, supports your immune function, protects your joints, enables your independence, and keeps you on your feet. Lose enough of it, and the quality of every single day of your life is affected. But here is what I need you to hear, and please, write this down if you can. Sarcopenia is not inevitable. It is not a sentence. It is a process, and it responds to the right stimulus. The research is unambiguous on this point. Studies from the University of Texas Medical Branch, Harvard Medical School, and the Mayo Clinic have all demonstrated that resistance training, even in individuals in their 80s and 90s, produces measurable increases in muscle fiber size, strength, and functional capacity. The mechanism works like this. When you place a muscle under tension, through these chair exercises, through resistance bands, through the controlled movements we discussed, you create microscopic mechanical stress in the muscle fibers. Your body detects that stress and activates a signaling pathway called the mTOR pathway, mechanistic target of rapamycin. This pathway triggers your muscle cells to synthesize new proteins, add new contractile filaments, and grow stronger. Your body does not know how old you are. It only knows the stimulus you provide. Give it the right stimulus consistently, 3 to 4 times per week, and it will respond. It has no choice. That is the biology. So when I say these chair exercises can rebuild leg strength, I am not saying it to make you feel good. I am saying it because the science backs it up completely. All right, let us put this into a practical plan that you can start immediately. Here is your weekly schedule. Perform all 5 of these exercises 3 to 4 days per week with at least 1 day of rest between sessions. Your muscles need time to recover and rebuild. That recovery phase is when the actual strengthening occurs. For each exercise, begin with 2 to 3 sets of the repetitions I described. If that feels too easy within the first week, which it might for some of you, add a third or fourth set before adding resistance. In weeks 3 and 4, if you feel ready, you can introduce light ankle weights, starting at just 1 pound for exercises 1, 2, and 4. For exercise 5, move to a slightly firmer resistance band. Progress should always feel challenging but controlled. If any exercise causes sharp joint pain, not muscle fatigue, but sharp pain, stop that movement and consult with your physician. A few safety reminders that I want you to take seriously. Always use a sturdy, solid chair, 4 legs, no wheels, firmly on the floor. If you feel dizzy or lightheaded at any point, stop and rest. Drink water before and after your session. And always warm up for 5 minutes with gentle seated marching in place, circling your ankles and rolling your shoulders before beginning. One final note on contraindications. If you are currently being treated for an active deep vein thrombosis, a blood clot in the leg, please consult your physician before performing leg exercises. If you have had a recent fracture that is not fully healed, the same applies. And if you are recovering from recent joint replacement surgery, work with your physical therapist to determine when these exercises are appropriate for you. For the vast majority of older adults, these 5 exercises are not just safe, they are exactly what your body needs. So let us do a quick recap before I let you go. Exercise 1, the seated leg press against wall, builds your quads and glutes through powerful isometric force with 0 joint compression. Exercise 2, the assisted sit to stand, trains the functional movement pattern you use dozens of times every single day, and the eccentric lowering phase builds strength faster than almost any other movement. Exercise 3, seated heel and toe raises, strengthens your calves and shins, powers your venous circulation, and directly reduces your risk of tripping and falling. Exercise 4, the seated knee extension with hold, isolates and rebuilds that critical VMO muscle that keeps your kneecap tracking correctly and your knee stable for years to come. And exercise 5, seated hip abduction, activates the gluteus medius, the gatekeeper of your lateral balance and the #1 muscle for fall prevention in older adults. 5 exercises, a sturdy chair, 3 to 4 sessions per week. That is all it takes to begin reversing years of muscle loss and rebuilding the leg strength that gives you independence, confidence, and the ability to enjoy every day to its fullest. I have said this before, and I will say it again. Strength is not something you lose forever. It is something you can earn back at any age when you give your body the right tools and the right consistency. So start today, even if it is just 1 or 2 exercises from this list. Start today and build from there. If this video helped you, please hit that thumbs up button. It tells YouTube to share this information with more people who need it. Subscribe to the channel so you never miss a new video. And tap that bell icon so you get notified the moment we post something new. And in the next video, I'm going to be revealing something that surprises most of my patients. The 5 warning signs that your leg muscles are weaker than they should be. These are subtle signs that most people dismiss for years until something more serious happens. You do not want to miss that one. Until then, take care of those legs, take care of your body, and I will see you in the next one. This is Dr. Alan Mandell. I will talk to you very soon.